Hey guys out there, welcome back to my channel and welcome to yet another episode of Sai Dental Vlogs. I am Dr. Abhishek and I make videos on dental related topics, about dental related products and anything which is related to dentistry. Regarding my previous topic, I think you people must have gained some amount of knowledge. In that video, I had not mentioned about aspiration, so which I had actually making the video I had forgotten. So aspiration is also very much necessary while giving the inferior nerve block. Regarding like my viewers and subscribers, I had got many comments: which college shall I take admission, where I should take MBBS, where I should take BDS. See, I have already made many videos regarding admission and NEET. So the best place to take admission is which is nearby your place and which your parents allow. Like if you are staying in West Bengal and there's no point in going to Rajasthan and studying, right? There are many colleges in each and every state, so go there individually and it's available online, the top 10, 20 colleges. There are many magazines and there are many resources where you can find out the top 5 or 10 colleges in India. So regarding today's topic is a very good topic what I feel, and it's very much necessary for the clinicians. It's nothing related to anything dental materials or dental things. So today I'll be talking about like how to train your attender. Right? The trainer is you. A doctor is a trainer of an attender. जो अभी आपके क्लिनिक में काम करता है, रिसेप्शनिस्ट, जो आपके असिस्टेंट है, असिस्टेंट मीन्स द पर्सन हु इज स्टैंडिंग beside the chair and who is holding the suction. That person आपको कैसे ट्रेन करेंगे? Suppose a patient comes to you. Suppose you are not there in the clinic. Your attender is there, and if he's seeing his mobile and he's not talking to the patient, that gives a very bad impression to the patient. So train your attender in such a way that he's very cordial with the patient. Whenever any patient comes to the clinic, he should greet the patient in your absence. And if in your absence, a very important job of the attender is to hold the patient, engage him in some talks so that the patient can wait for some time. And if the patient is coming, the attender should switch on the TV, he should switch on the air condition and tell the patient ki what was your appointment, let me check your prescription late. Or if you have gone for some work, like the doctor has gone for some work, the attender will call the doctor and say the patient has such and such has come, so you please come and just do the treatment. Has to call the patient by seeing the appointment diary or in the computer. He should check the diary and he should call whatever patients who have missed the appointment. They should call him again for something, anything, for crown, for root canal, second sitting or third sitting. Do the training from the very beginning itself. From the very first day, you have to be very strict with the trainer. Whenever the attender will come to your clinic, new attender, so you have to show him all the instruments. Starting from the root canal, you just don't make him sit and do the suction. You have, after the clinic ends, you have to show him all the instruments, extraction instruments, root canal instruments, RC help, AVU cal, what is RC cal, what is all the things, air rotor, what is micromotor, what are bursts, what are the different type of instruments, where you have kept. Usually the delay is there. While working on the patient, you don't know where you have kept the instruments. You need to know where is the scissor, you need to know where is the suturing material, you need to know where is the suturing needle, artery forceps कहाँ रखा हुआ है. तो इसमें काफी time like it gets wasted while taking out the instrument, whereas the impression trays. So whenever the patient comes to the clinic, one very important thing is that the attendant should come before the doctor. Yes. Many clinics I have seen that the doctor will come first regularly on time at 5:30 or whatever, and the attender will come half hour late. Why are you allowing so? If an attender is not coming on time, just get some new one, right? Because attender has to reach before the doctor, at least 15 to 20 minutes before the doctor, and he has to open the room, he has to vent the room, he has to switch on the AC, he has to clean the room, clean the chair, clean all the apparatus, keep the instruments ready for the next appointment patients. So this way you have to train from the very first day. You have to tell the attender that you have to, after doing the root canal, you should keep the instruments separately. Then after wearing the gloves, you should clean them. Then you should autoclave them properly. Like this, you have to be very strict with the attender. If you keep loose, your attender will also become loose, and this way you will not be able to work efficiently. For example, I'm using a root canal using a rotary endomotor. So you should know what color file I use. I will say 8%, give me 8% 30. He will give you 8% 30. Just click it and use it. So he should know what is the next file, and ready and hypo ready in the next syringe. So after using one file, you need some Avu prep, so he will just put it in your gloves and then you can use it. Then second file, okay, give me 4% 20. So it will be already ready and he'll just make you all those things ready one by one. So that way you will be able to work very fast and you will be able to do more number of patients in a very efficient way. Regarding the payment of an attender, actually what I feel, you should pay an amount which is not very less for the attender, because if you pay him very less or her very less, what will happen is he will lose interest in the work, and slowly you should you should give some perks also. You should give him some holidays, 2 to 3 days whenever he requires, and whenever it's required you can call him during urgent basis also, like Sunday if your clinic is not open and if a patient comes with some emergency, if you call, the attender should be such that he will listen to you and he will come to you. You should give at least 15 minutes of your valuable time to teach him, because you cannot work alone in a dental clinic, right? I am having 2 attenders in my clinic, but at least one attender. Many clinics I know in which there is no attender at all. So what is the problem? The doctor is working, he is only cleaning, he is only keeping, he is only autoclaving, he is only asking money from the patient, which looks very disgusting and it's very tiring also. You won't feel like working on the patient. So a doctor is what? डॉक्टर आएगा, काम करेगा, नेक्स्ट पेशेंट काम करेगा, थर्ड पेशेंट काम करेगा. ऐसा नहीं कि डॉक्टर ही आ रहा है, सब कुछ साफ कर रहा है, डॉक्टर इज ओनली क्लीनिंग एवरीथिंग. सो it's very disgusting. You can't talk to the patient also in this way, right? You have to talk to the patient in a proper way, and if you're already tired, you're already exhausted, and you have to pour the cast also, so 101 things will be there in your mind, right? So you won't be able to work that efficiently on the patient. Plus a root canal which can be finished in 3 sittings will take 5 to 6 sittings, and the patient won't get time to get crown and he'll be irritated from you, right? So what I feel, the training of the attender is very much required, and what is the education level of the attender is also important, right? He should be minimum 12th pass or a bachelor degree holder, because see, the level of education also determines the attitude of the person, right? Suppose you are keeping a class 8 pass or class 10 pass fellow, so he won't be able to write also, and he won't be able to read all these things also. But try to get an attender who will stay for you for a very long time. अब long time तक कैसे कोई बंदा रहेगा आपके साथ जब आपको ऐसे अच्छा पे करोगे? And believe me guys, अगर आप attender रखोगे 6 महीने के अंदर आपका क्लिनिक में improvement होगा. That is written because your work efficiency is increasing. You're increasing. अब देखिए धीरूभाई अंबानी जो रिलायंस कंपनी है, कितने सारे लोगों को एम्प्लॉय कर रहे हैं. क्यों? सब लोग मिलके काम कर रहे हैं, तो फिर एक पूरा क्लिनिक जो है बहुत अच्छे से ग्रो करता है. आपका काम जो आप एक दिन में 3 पेशेंट या 4 पेशेंट कर सकते थे, आप 6-7 पेशेंट कर पाएंगे. So that is the thing, benefit of keeping a attender, and it's very much required what I feel. अगर आपके क्लिनिक में अटेंडर नहीं है तो प्लीज किसी को रखिए, और अटेंडर के साथ अगर रिसेप्शनिस्ट भी रखेंगे तो उसका और तो फायदा है, लेकिन इट रिक्वायर्स लॉट ऑफ मनी इन्वेस्टमेंट. सो एटलीस्ट हैव वन अटेंडर इन योर क्लिनिक विच विल बी वेरी यूजफुल फॉर यू. बस आज के लिए इतना ही रखेंगे, एंड प्लीज डू राइट कमेंट्स, एंड थैंक यू फॉर शोइंग सो मच इमेंस लव एंड सपोर्ट टू माई चैनल. And if you have not followed me on Instagram, please do follow me on Instagram in Sai Dental Vlogs. DM me, I will reply to your queries. Namaskar.